Okay, first is the gastrocnemius, so it's a standing calf raise. So stand with your feet hip width apart, raise your heels as high as possible, then pause, and then lower them slowly. You want to do this ideally on flat ground or like elevate or like a stair or something for a bigger stretch. The origin is the medial and lateral condyles of the femur. The insertion is the calcaneus, like from the Achilles tendon, and the action is plantar flexion of the foot and then flexion of the knee. Next is the soleus. So it's a bent knee calf raise. So stand, or you can sit or stand with your knee slightly bent. Rise onto your toes, keeping these bent the whole time. And then this this exercise takes away from the gastroc and isolates the soleus instead. The origin is the posterior tibia and fibula, and the insertion is the calcaneus, again from the Achilles tendon, and the action is plantar flexion of the foot right here, and the knee is bent. Next is the tibialis anterior. So you could sit or stand, and we're doing toe raises. So lift your toes towards your shin while keeping your heel on the ground. You could do a resistance band or a kind of rope or some mechanism to add extra resistance. The origin is the lateral condyle, and the insertion is the first metatarsal, I believe, and it's dorsiflexion of the foot, right here. Alright, next up is the tibialis posterior. So sit with your leg extended, and then I have a band anchored to my squat rack here. So then you pull your foot inward, like towards the midline of the body, and then against the band. The origin of this is the posterior tibia and fibula, and it comes from the bases of the metatarsals, and the action here is inversion of the foot. Fifth, we have the peroneus group, and this exercise is a resistance band around your foot, and move your foot outward, or with using eversion away from the midline. The origin is the longus and the brevis. The insertion is the first metatarsal for the longest, and the brevis is the base of the fifth metatarsal, and this action here is eversion of the foot, moving to the lateral side. Finally, it's the intrinsic flexor muscles in the foot. So I have a towel here, but you can use almost anything. You can sit or stand. Basically, you want to take your toes, grab onto whatever's on the floor, and pick it up and move it towards you. The origin of this is the flexor digitorum and the flexor hallucis. I'm not quite sure how to say it. But the insertion is the middle toes, and the action is flexion of the toes. And you can pick it up, put it down. You can make things heavier for more difficulty, but otherwise that's it. Thank you.